You graduated from Melbourne, you are running a very successful business today. I mean, what happened in between? What have been the big decisions and the defining moments in your career where you say, look, this changed everything?
When I started dentistry, I became interested in dental implants. I thought there must be something better than dentures. But really, what I do on a day-to-day basis is not just dentistry. It's really helping patients achieve an improved quality of life.
Welcome to ProTalk. Welcome to the Pulse of Dentistry. Welcome to the IDS. We are recording this podcast directly from the IDS. And today, this morning, we have a guest. We welcome a guest that had a long travel to come to the IDS, straight from Australia, Melbourne, Dr. Alex Fibishenko. Good morning, Alex.
Good morning.
Good morning, Alex.
Good morning.
Great to have you. Thanks for making all the way from Melbourne, Australia, to the IDS and to Cologne.
Yeah. We're used to it. In Australia, we always travel very far. Everything is far for us.
First, you have to get off the island, right?
Yes.
A big island,
Well,
exactly.
it's not an island. Well, it is an island. Everything's an island, isn't it?
That's true.
So, Alex, you are a trained dental surgeon. You're focusing on oral surgery, and we will see this on quite complex cases. You've been trained and graduated in Melbourne.
Yes.
What I found very interesting, after you gave yourself a very extensive training, international residency program, you saw a lot of great clinicians and learned from a lot of great clinicians like Paolo Malo, Craig Misch, Carl Misch, Andres Stricker, and just to name a few of them, James Chow. So you embarked on quite a learning journey, and since more than 25 years, you're running very successfully your own clinic. You've been awarded by, I have to look this up, by the title of Leading Dental Centers of the World, which is very prestigious. And in the meantime, you are also helping more than 20 other clinics to be successful, and we come to this later. So, Alex, to introduce yourself, where's your passion, where's your focus today? Who is Alex Fibishenko in 1 minute?
Look, I'm all about the patients and trying to really keep a balance between. Right now, it's about keeping a balance between the family and the business and the patients. I mean, this is sometimes a difficult balance to strike, but really, what I do on a day-to-day basis is not just dentistry. It's really helping patients achieve an improved quality of life. I mean, this is what we think about, not just the technical side of things or the dental side of things. It's more about helping them improve what they do on a daily basis. And it's really satisfying to do that, because you're not focusing on a procedure. You're focusing on the satisfaction that the patient shares with you at the end of the treatment, which is helpful not just for me, but also for the staff. You know, it really motivates everyone to keep doing better and to keep producing these kinds of results. So it's something that we are always motivated to keep doing, and it's something that's taken a long time to
establish,
and to perfect, and to develop the right team, and all those sorts of things are not. We try to make it very simple for the patient, but, you know, like Leonardo da Vinci said, simplicity is the ultimate sophistication. It takes a lot of sophistication. It takes, you know, the people, the processes, the product to make it all happen. But we have it now, and it's really right now we're in a good place where we have all that. We put all that together, and we can offer those types of transformative solutions for our patients.
Yeah, it takes a lot of dimensions, a lot of topics to bring this success, I imagine. But it seems you are very mindful, starting with the purpose and with the patients. And I think that's really motivating for the team and the people surrounding you. That's a very strong motivation for them. Today, what we will cover very complex full arch surgery. Yep. That you are passionate about. We will cover education, and we will speak about your business model. I'm very curious to learn more about the way you bring this business model to success. I think the first bit we heard already, which is the patient and the purpose part to motivate the people surrounding Tell us a bit more about your story. You graduated from Melbourne. You are running a very successful business today. I mean, what happened in between? What have been the big decisions and the defining moments in your career where you say, look, this changed everything?
Well, I'm not sure if there was something specific that changed everything, but I became interested in implants very early on. Those who follow me on Instagram and some of the social media, they would already know this story has already been told too many times. But one of the important things that motivated me was even before I was in dentistry. When I was a child, my grandmother had this loose denture that used to traumatize me. Every time she fall asleep, the denture would fall out of her mouth because her head fell back and the denture fall out. So as a child, this is like very traumatic to see something move in the mouth. You don't expect it. You expect the teeth to be like teeth, and suddenly something moves in the mouth. You don't understand what is happening. So this was quite traumatic for me as a child. And when I started dentistry, I became interested in dental implants. I thought there must be something better than dentures, because she was suffering with that concept. And I started looking through studies and research in that area, and there was really not a lot around in terms of support or in terms of university education or any type of education actually at that time. We're talking 91 to 95. Those are the years at university. And during that time, I spent a lot of time. So at the same time as I was studying, MO amalgams, I was also doing a lot of looking into the research and development in the implant world, and I was motivated by a lot of the people who were actually in the studies during that time. And from that point, that gave me a point of where I wanted to go once I graduated, who I wanted to visit and where I wanted to go, and how I wanted to pursue those further education and development in my own career. And then once I started, it was actually difficult to find a course, to find a mentor, to find someone to help you to do your first implant. And I placed my first implant within 6 months from graduating, and within that 6 months, it took I had to undertake some training because there was no training at university. So I had to pursue. So there was really no training available. There was only available for some specialists, and I had to. So through the I got into some courses, and they let me in, and together with some specialists, and I managed to get in and did some courses, and then I used to attend. Every case I used to refer, I used to attend together with my patient, and I used to watch the case, and that was my condition for referral.
To learn from this.
To learn from it. And I said, I would refer the case, and sometimes the periodontist would say, look, I don't work that way. I don't accept the dentist to come in to watch the surgery. Yeah. And I would say, that's fine, no problem. I would refer to another periodontist who would allow me.
Is this also the reason why you embarked on such a significant learning journey after with all the great clinicians?
Absolutely. Yeah. So this was the start of, very quickly after that, I became, that's what motivated me to start the training programs, because there was not a lot available at that time. There was some didactic training that has emerged over time for, especially in Australia, for learning the basics of osseointegration and things like that, but not a lot about the skills and the techniques and those sorts of things. There was not a lot around, especially for general dentists.
How did you select these people that you learned from, like Paulo Malo, the Misch brothers, Andre Stricker? I mean, were there like specific techniques you were looking for?
Yeah, so those people were generally through techniques. With Paulo Malo, there was I've attended the Malo Clinic. Essentially, was for a collaboration on the educational front. So we were already doing our all-on-4 procedures in Australia in a different way. So our technique is different to the Malo technique, the way we do our all-on-4 procedures. But he had a very impressive training center in Lisbon, and for me, I wanted, because we were building a training center also in Australia, I was quite interested in seeing what they're doing, how they're doing it, and also we were building a bigger training institute. So we were interested in doing a collaboration, and for a few years we were doing a collaboration with Marlow Education. So I attended the Marlow Clinic to explore that collaboration between our two centers.
You also, over the last years, you transitioned from another implant provider to Straumann. What prompted this change, and what did it do to your practice?
So changing implants is difficult, especially if you're a busy implant surgeon, and if your staff are used to one type of implant. You don't want to have 10, 20 different brands on your shelf, different types of implants. It's difficult. You want everyone to be aware of what they're doing. You want your staff to know the item numbers of the implants without even looking them up in the catalog. So it's a difficult decision. And everything changed when BLX came about. Mm-hmm. And BLX was really a game changer for me, because I recognized very early on, just by seeing the design, without actually even manipulating the implant, just by seeing the design, I became interested in it, because I could see that it allowed me the control that I always talk about in all of my lectures. I talk about in my training. I always talk about control.
Keeping control, yeah.
Keeping control. You have to have control of the surgery. You can't just put the implant in and hope for it to integrate. Hope is unreliable. I want to control the surgery. So you control it through the technique, you control it. Also, this became now a possibility to control it with the implant. And that implant gave me the ability to have that additional control. So that was very impressive for me. And as soon as I started using it, very quickly I realized that control was indeed possible. It was possible, and I have there is, of course, a protocol that you need to follow, and I have modified that protocol in a number of ways over time, because you can. That implant is very versatile. I also like the fact that it's rock solid, and it's got the SL active surface, which is a very well documented and a surface which can be used in many situations in patients who are diabetics, who are smokers. We don't advocate for patients to start smoking, of course, just to test the surface.
But in case it helps us. Yeah.
But we do ask our patients to quit, but we don't. But it's nice to have an implant which has in the literature a surface with a track record of a better success in those types of more challenging situations. So that's really helpful. It's also got a very nice platform shift. The platform shift allows for a more soft tissue biological space for the soft tissues, which is nice, which means that the bone can retain itself over time for a much longer duration, and that's a big advantage. So this is the reason why I decided to switch to BLX. Those were the main types of reasons.
The personal Alex, how do you keep balance? You're very busy. You are an international speaker. People ask you on stage. You do a lot of education yourself, training. You have one clinic running yourself. You have some others that you are supporting heavily. How do you keep balance?
It's tough. It's tough. The good thing is that over time you get quicker. So I'm able to knock off surgeries very quickly. So when I am on, I'm on. I do a lot of surgeries, and we can, and the patients get treated very quickly, and then and in between. So I don't actually only work 4 days. I dropped Fridays. Probably about 6 years ago, I stopped working Fridays altogether. So I only see patients for 4 days. So I always tell everyone, I dropped Fridays, I don't work Fridays anymore. But my wife always goes back behind my back and just says, he dropped Fridays, but he picked up Friday, Saturday and Sunday.
for doing more work.
For doing more work. For
preparing courses.
For working on the business, for doing on the education, on that side of things. So from that perspective, it is difficult. But look, you try to do your best. I mean, this is it motivates me it's what's kept me. I think when I'm not doing things, like you get bored. So I'm one of those people. I just need to keep doing things. So.
Yeah.
Any routine for mental health that you developed for yourself?
I think just to keep moving. I think once you stop, you just there's a risk there. But look, mental health is. I have friends who suffer from mental health, and I'm very sensitive to that. It's a problem in our profession, and it's something that we need to be aware of, and we need to support our colleagues, of course, and this is an illness that needs to be recognised and dealt with. But I don't, at the moment, I don't have a great deal of it. Maybe a little bit of it in the background. I don't know, but I'm just trying to be too busy to have a focus on that part of my. Yeah.
Before we move over to your passion, which is complex full arch rehabilitations, you spent 2 or 3 days, I think, now on the IDS, and the IDS is a place of innovation. What stood out for you? Anything that you would underline?
Well, firstly, this thing is massive, this IDS, and it's just, I've never expected it to be this.
It is. Yes.
This big. It's just overwhelming, and I'm just so impressed. This Straumann booth and the lecture, it's unbelievable what you've done here. So really congratulations on this. You're like stand out here at the IDS. This is really a great achievement to have this type of to be seen in that way in the IDS, which is so massive, and Straumann stands out in such a way. But what stood out for me, look, I think just the variety of the new introduction of products and the range of products that you have for going from implants themselves, but also now to integrating the digital workflow, to having like on the bench printers and scanners and all that sort of stuff. I think it just gives the patients it gives the dentist this opportunity to provide these types of solutions and work with a partner who not only provides them with the implants themselves, but now can also support them in those other ways. And I think partnerships are important. So if you develop a partnership with a brand, with a company that helps you in one aspect, I find it's always nice to grow that relationship as much as possible. And if they can provide other stuff as well, it's important to cherish and to grow that relationship, as opposed to having 100 relationships with many other companies. So I think it's really nice that that Straumann has that view to introduce other components to what they do.
And a lot happened this IDS, so yeah, that was a very good week. So maybe let's move on a bit to one of your big passions, fixed full arch rehabilitations.
Yeah.
And you gave a bit of insights on how you came to implantology, but I think from that point on it developed much further. You're a world leading specialist actually of very complex rehabilitations. You treat patients with severe bone atrophies, and if anyone looks at your cases before and after, I believe that these are really life-transforming interventions for the patients. So where we started with you're looking at trying to achieve a goal for the patient, I think that really materializes with the surgeries you're doing. What brought you to this step? I mean, these are probably one of the most complex interventions that you can do, and it's a lot is at stake.
Yeah.
How did you come to that point to actually be specialized in those kind of very complex treatments?
So I just want to clarify firstly that I'm not a specialist. I'm a general dentist, but I do specialize in a very, very specific type of treatment. So I do I spent for many years already, because there is no speciality in dental implants. Dental implants is something that the periodontists, oral surgeons, dentists do as well, and it just depends on the type of training that you receive and who you receive the training from. So I'm not a dental specialist, as in a registrable specialty. But yes, you're quite right that my practice is very focused on a very specific area, which is full arch, and not only full arch, but also full arch surgery only. So that's what I do on a daily basis, is the actual surgical component. And today, most of what I do is the complex cases, because I am also supported. I'm lucky to have around me other associates who do all the simpler types of cases. So I end up with the more complex types of cases. But how I ended up here is that it's through that model of when we started our business. I know you were going to get to the business side of things a little bit later on, but part of that model was to develop a relationship with people where I can help them achieve certain goals, but then they would help me also take less responsibilities in the early stages in the simpler cases so that I can do the more complex cases. So that was part of the plan from the beginning. So now I end up with only the most complex cases. And for me, this is fun. This was something that helped me in the growth of my own skills and my own career. So I don't mind the simpler cases. The complex cases don't stress me out. What causes me the stress nowadays is to do more with dealing with people and the business side of things, not so much the surgery itself. In fact, the surgeries are the most relaxing part of my day.
Okay. From the outside, I can follow, but it's probably quite exceptional that you can relax during such a surgery. So.
Yeah, they're complex surgeries, but there is no complexity that it's all in the planning. So if you plan and you've prepared for it, and you know what the limitations are, and you accept those limitations, because sometimes you can't achieve something. So the worst thing you can do is that try to achieve the unachievable and then fail. So you know you're going to fail. But if you're prepared for that, if you already know you won't be able to achieve it, then you will try to do something that you can achieve, and then you will succeed. So that's what I do on a daily basis. Is I look at the plan, I reevaluate it even before surgery, during the surgery, and I always make those changes to make sure that we achieve a successful outcome. So I don't always rigidly stick specifically to what I planned just because I planned it that way. We always are. I always try to be open to what I need to do to achieve the success for that particular case. Always bearing in mind the original basic concepts of implantology. This is not a mechanical process. We're not putting screws into concrete. Or into timber, or into steel. We're putting screws into biological tissues. The tissues, they need to heal around the implants. And it's not just something that happens once. It's something that recurs. It keeps on happening over time. And we need to not only achieve osseointegration, we have to maintain it over time. Yeah. So these are the concepts that I think about, the very, very basic concepts of osseointegration that I think about in every case. Whenever I do surgery in the planning, and then as I execute the treatments.
In terms of learning and adaptability, I think this is something very innate to you. And I vividly remember one of your lectures in Mykonos, where you quite openly shared your learning curve over the last 1.5 decades on these complex procedures. And you gave also the audience a chance to understand that, well, it's not something that you learn one day and then it remains. You have to constantly evolve. And one of the things that struck me, and you mentioned it also in the beginning, is how important the team is. Maybe you can speak a little bit more about how you design your professional environment for success, because I know you have a purpose-built practice, but I think there is much more behind that this actually, continuous success happens.
Yeah, so you need to have people that can support you and that you can trust. I mean, this is critical to have people you can trust. And obviously they need to be skillful enough. I mean, some of the people that I didn't think were going to turn out as the best kind of nurses have ended up being my senior surgical assistants, and didn't show a lot of promise at the start, but ended up being stars in the end. Look, it's staff is difficult. Dealing with people is difficult. Knowing who is the right person is a difficult thing. But it's something that we try to also promote from within the clinic. So people start with in other areas which are the more simpler general dental areas, and then slowly they try to reach a point where they can help with surgery. They need to fully understand. I mean, we do all our procedures fully sterile, so they're like heart surgeries. They're like fully sterile procedures. These are not the way that the procedures are done in every practice. I'm very conscious of that. I have seen this is not the way that many practices are set up that are fully sterile, but this is just the way we do things. We also do things under general anesthetic. So this is something that was critical for me, that I recognized very early on, that for patients it was important, for the type of workflow that we do and the speed that we do it in. It was important for our patients to receive the treatment while they're asleep. And sedation was problematic, because sedation, from my perspective, is like a general anesthetic, but on a it's much less safe.
Deep. Yeah.
No, it's less deep, but it's also less safe because it's unprotected airway. So the only difference between general anesthetic and sedation is the protection level. It's the same drugs, it's just your airway is not protected. So we use general anesthetists in an environment which is like a hospital, and anesthetic nurses. And then we produce this environment where it's a hospital environment for the patient. So it's very safe. And it's much safer than doing it like under sedation, where the airway is not protected, and you can inhale, you can drop components, or water can trickle down into the throat, into the airway. So we created that very early on. We wanted to make sure that this forms part of our workflow of being able to create this 24-hour final teeth. General anesthetic, provision of a general anesthetic was a very important component of that. Building facilities, so part of our business model and growing it is that all our associates, all our partner clinics, they need to have access to these types of environments. So either they need to invest in their own facility and expand, and we have a branch of our business which helps them expand into the general anesthetic side of things. So this is how we try to collaborate with our partners.
Very impressive. So you basically control, or try to control as much as you can, from anesthetics to clinic layouts, and also then staff selection.
Yeah, and I have to say also, we're talking about, we're covering those specific elements, but there's so much more that goes into it. Of course, it's the laboratory support. One of the biggest, one of the biggest challenges I find that some clinicians raise with me is they feel like they can't do it because they don't have a laboratory on site. But things have changed. We now have access to full digital. You can now do a fully digital workflow. You can do what I do and use any lab in any part of the world, and the only time frame that's going to be the delay is the freight. So even if you have a laboratory which is 50 kilometers away, it's still going to be okay. Doesn't have to be on site. Even if you have a laboratory in the next city, even in the next country, you can get it delivered the next day. So as long as the laboratory understands the steps that need to be done, today, with the digital workflow, you're able to use any facility because all the information is now digital. So you're able to create the same. You don't need to have a laboratory on site to be able to do exactly what I do.
That's a perfect segue also to talk a little bit about digital workflows. You are very digitally equipped. So what has been the game changers in the last, 2-3 years for you in terms of digitalization of your clinical operation?
I think the introduction of intraoral scanners was nice, but the intraoral scanners initially had a limited application for us until we had photogrammetry. So photogrammetry was really what changed everything for us. because with the digital scanner, especially the first models, there was also always a concern with how accurate it is for a full arch restoration. So in my world, there is no levels of accuracy. There is only one level. It's either accurate or it's not accurate. There's no different levels. It can't be 90% accurate. It is either accurate or it's inaccurate. So with the digital scanners, there was always because the way that that it works, that because of this technology and the images put together, that there's always a discrepancy. And with photogrammetry, because you're not relying on combining images together, it's a very accurate, precise way to connect to take a correlation between the implants to each other. So once that came about, then using the intraoral scanner together with photogrammetry then enabled us to move into this fully digital workflow. And it worked particularly well with my specific workflow, from which we've been doing for many years, which is the workflow of maintaining certain teeth as references, so that those teeth are used as references for positioning the implants in the best possible spot so that it's comfortable for the patient. And that very same technique that I advocated so many years ago is still now useful for the digital workflow, because it enables this correlation from the preoperative work to the smile design and to the implant positions now.
Yeah, that's a very interesting topic. Also, then looking at the future, what are your predictions? I mean, could photogrammetry be actually made obsolete by more and more precise intraoral scanners, and would that be a benefit?
Look, I think photogrammetry needs to become cheaper. It needs to become cheaper, and because the problem with photogrammetry is that it applies for people like me. Photogrammetry is an investment that's worthwhile because we do a lot of implants. We have multiple multiple scanners, these cameras. And so for me, it's absolutely worthwhile. But for a person who might do only a few implants, a few full arches in a year,
it's an additional investment.
It's a big investment because they don't do any other dentistry with this device. It is only purely for implants. So it is a difficult decision to come to make this type of investment. So something needs to be done about that. But I think the concept of photogrammetry really makes sense. And I think, in my personal view, I understand that there is a lot of emphasis on digital scanners and all that sort of stuff. But I still feel at this point, photogrammetry is still the strongest and the most accurate, the most precise way to record multiple implants to each other, especially in an arch. When we're talking about two implants separated only by a space, one space, that's one thing. But when we're talking about a full arch, that is a completely different ball game. And I think, from my perspective today, photogrammetry is still the most accurate way to be able to achieve accuracy.
Maybe last question. We could still continue a long time for, very interesting. But what's your opinion on subperiosteal implants?
So subperiosteal implants is, I've read about them, I've seen them, I have not personally done them, so I don't have any experience with them. So I couldn't comment from an experienced viewpoint. Generally, I think there is a place for any kind of treatment. Look, it's obviously been done many years ago, and it's making a little bit of a comeback in some parts of the world. And some people, including myself, just feel like maybe it's a reinvention, trying to reinvent the wheel, trying to reintroduce something that has already been tried before, and with certain improvements. But I think, why not? I mean, yes, if there are improvements, if there are ways to achieve another outcome for those patients who are severely atrophic or patients who are not able to get standard implants, why not explore treatments that have the ability to give patients a fixed prosthesis?
And there has been some technological advances in the last 10 years that really make this potentially also more precise and less prone for, let's say, complications. So, yeah, interesting area to explore.
I mean, if the complications that are known in the past can be reduced, that would be a great advantage. I mean, the same thing happened with Zygoma implants. So with Zygoma implants, the reason I was reluctant to be using them for a long time was because the technique was wrong. I was not supportive of the technique. I could not inflict this on my patients, to do this procedure on my patients. When we started to get into Zygoma, I actually developed the technique. I improved the technique to a point that I considered that it was going to be appropriate. It was going to work in the same way that standard implants would work in my practice. So I took models, I took skulls, and I tried to refine the technique to a point where it could work. And this is when we started to do the Zygoma treatment, and that's when they started also to improve the surfaces, to improve the way that the Zygoma implants are made, and especially with the introduction of the Zyga implants, I became, obviously it's more you can be a lot more confident putting the implants in. So with those improvements, Zygoma now is something that is a predictable treatment. It is something that's, you don't have to be skeptical about it like you were with the older techniques.
No.
And in the same way with the subperiosteal implants, if those complications, if the technique can be adjusted, the complications reduced through the technique and through the design of the implants. Because with Zygoma, both things happen. We change the technique and we change the design.
And the product design.
So both of those things changed, and that hugely improved the outcomes. And if both of those things can be done with subperiosteal implants, especially for those types of patients who are severely resorbed and possibly patients who have had failures with Zygomas, or failure, they can't have other treatments, then for those patients, absolutely, I'm against dentures. So for those patients who
it's the last land of resort then.
Yes.
For those patients. Let's switch a bit to your business, to the business side, which I think is very exciting to speak about this with you.
Yeah.
So I understand you're running a big clinic in Melbourne, which is, I think, the heart and soul of what you're doing. How big is this clinic?
So the clinic is how big in space? It's got two theaters and 4 other operatives. So it's not a massive clinic, but it's more of a training center as well. So this is where we do all our residency programs. We've got a training. So the theaters are big because we allow for 10 to 12 people to be able to attend and to attend the surgeries and to participate during the actual surgery itself. And then we have a conference room where we've got the lectures and the presentations, and we've got the on-site laboratory and the car spaces. And we're currently going through a process where we're building another theatre with 5 additional recovery beds and all that sort of stuff. So this is just happening now. We're just about to start this construction as well. But I also work with, so this is my clinic, and like I said, I work there 4 days, and but I also work within other clinics where we establish this connection. We attach an annex, a facility, a general anesthetic or something like that, where we can produce the same types of treatments local to the patient, so they don't have to travel. We used to see a lot of patients traveling from all over Australia and all over the world actually into Melbourne to receive this treatment, but now we can offer it locally. So we use our brand name, we use our brand strength, we use our all of our the system, and we're now offering it in more and more locations, so it's convenient for the patients.
So these are also full arch centers using your name, using your concept. How many are those? How many are
There's 23 in Australia.
23, okay.
Yes.
So all over the country?
Yes, and we're actually going through a process now where we have now the ability, because part of the concept of this network of clinics is the training and the systemization of the clinics. So it takes time to onboard new clinicians.
I can imagine.
So it's not something that that can happen, that we can just sign up every clinician that's interested. It does take some time and it takes effort. But now we have a team which is dedicated to that. And we also have additional, we have all the associates who are now, who've been with us for more than 10 years, who are now senior associates. They're also helpful in that regard. Yeah. And then they're also are able to train other associates who are newer. And so everybody's now helping to try and grow the network.
How is the model built from, let's say, from a relationship perspective? Is it fair to say it's kind of a franchise model? Is the clinics owned by these associates? Or?
Yes, so it's precisely how it works. I don't own any of those clinics. Those are independently owned clinics, and they're essentially become part of the franchise. When they become part of the franchise, they get access to the systems that we have and the resources that we have. So the systems involve firstly the brand name, and the next thing is going to be the resources, which include all of the protocols and we have a patient management system as well, which allows the communication and collaboration with the patient, the production of the treatment plans, the production of a risk profiling for the patient, so that the clinician and their staff are able to actually create a risk profile for any patient. And that is a software. We actually have as many software developers in my team as we have dentists.
Really?
In my team, yes.
So it's really a focus, so that you want to get to this risk profile of the patient,
yes,
to continuously also evolve and become better as a group.
I mean, the risk profiling is really important because the data can be collected from different points of the patient's journey, and every time you collect a certain data, any part of that data can sometimes be critical to the patient's risk profile. So it's important to draw that data from the right points and to use an AI-generated tool to be able to create that risk profile and to be able to show it not just to the patient or to the dentist, but also to the treatment coordinator, to the other collaborators, to the anaesthetists, so that everybody is aware of what are the factors surrounding the management of this patient.
You're probably seeing a lot of patients with comorbidities, right? So
yes, that's
the patients that come to you, these are complex, also general health topics that you have to consider.
Yes, and sometimes, and quite often, if you just come with a comorbidity or a certain problem, it would be a hard no. But once you've got a system which can evaluate everything else, then you can see that there are ways around it. Yeah. There are ways to overcome certain things. And
so you're back to the topic of, controlling, knowing the risks and being able to control them.
Yes,
right?
it's all about control. Everything we do is about controlling the outcome.
Makes a lot of sense
for the patient. Yeah.
I could continue another half an hour to speak about your business model, because I know also you are very strong in terms of the marketing side and patient marketing side of it.
Yes.
But I would like to move on to the topic of education. I looked into your Instagram channel, which I would recommend everybody to follow. It's a very interesting and lively Instagram channel. And there was one format that, particularly caught my attention, which was the plan and recap format, which I find a very interesting, educational snippet, let's call it, right?
Yep.
So how did you start this, and why do you do this?
So the plan and recap was something that it just came about randomly, because there was a period of time where we suddenly got inundated with questions about I saw this case that you did this and that. Why did you change it? And then there was other questions. A lot of people questioned why I made certain decisions during the surgery. And I thought, because of the consistency of the questions being asked, I thought it would be nice to maybe just regularly talk about certain cases and talk about why we planned certain things. And then why I changed the plan during the surgery. What are the reasons to change it? because that's really important. Some people feel like some surgeons are feel like they're obligated to fulfill what it is that they promised on the treatment plan for the patient. So if they said they're going to put 4 implants on a patient, that means they have to put 4 implants because that's what they plan to charge. But I have a different perspective. I feel I'm obligated to fulfill what I promised to the patient, which means to get them a full set of teeth, not to get them the 4 implants. So I need to do what I need to do to be able to establish that. I need to achieve those parameters. If I need to put an extra implant in, if I need to undertake certain amount of grafting, if I need to do some other procedures, I will do that, and I will change that with no hesitation. And the patient is aware of that. So it's all about setting the patient's expectations before the surgery so that you're free to do that during the surgery and then make those changes.
I really like it because it's a very short and crisp and regular way of, educating people. But I know you have much more depth to this. You do your master classes, and I think the lighthouse format, and I think everything seems to come together with you, your purpose, the passion for this, complex rehabilitation, your passion for education, everything comes together in your Full Arch Summit that you created, that is happening every year in Mykonos, or every 2 years in Mykonos. And we are really the community of, these people that are professionals and doing these Full Arch rehabilitations are coming together. How did you come to this idea, and what can people expect from the next summit happening in 2026?
So, look, originally the Mykonos Summit was designed for the people who attended my residencies in the early days. They wanted to come back for another residency, for another program, and we couldn't accommodate them because we already had residencies booked for other countries and for other people. So I decided, look, why not just make one conference which is involves everyone, just slightly bigger conference. So it was. So we decided, okay, well, if we're going to do that, then why not do it in an exotic location so that people can also bring their families. They can kind of to make a little bit of a holiday out of it, and they can interact and with the other people who attended, because they all have similar interests. So that was the idea, is to focus on the people who I had a relationship with already. So the first Mykonos Summit, we had 70 people, and that was really nice. But then everybody else started to hear about it and started to want to come. And how come we didn't know about it? And why didn't we?
That's the best recipe.
Best feedback.
Where did I? Didn't I read about it? Where was it? Why wasn't it advertised? Why wasn't it? So then we decided to open it up, and then the next time it was double the size. And of course, last year was the third Mykonos Summit. It was again double the size. It was the capacity, which was 250, and already for the 2026 we had a pre-registration, and that is already almost. So the pre-registration is almost full. Yep. So that means as soon as we fill the hotel, that completes the pre-registration. We will then open the registration, but then they will not have a guaranteed hotel. They will have to stay in other places. But the theme for this year is that, so last year the theme was the digital workflow, and all the speakers that I selected were more focused on digital workflow, with all kinds of surgeries for full arch. So it's always full arch. Next year, we're going to try and have a little bit of a spin on complications. So we want to try and have prevention of complications and management of complications. Yeah. So I'm going to talk to speakers who are going to add value in that area on management of complications and prevention.
No, very much looking forward to this, and I think it's a great format also for, I would say, a very specific field of indications, where I think it's great to bring all the greatest clinicians of the world together into a beautiful place. So, starting with the IDS series, we created a new habit, and we invite our guests also to ask a question, and I know you brought a very interesting one, Alex.
Well, yes, let me have a look at my phone, because I think I had a couple of. I have posted.
You even posted them.
I have posted some questions for my community to see if anybody else has any types of questions for you. And I think, right. So one of the questions is to do with, do you have any plans for any type of expansion in the portfolio in Straumann? Any further?
Many.
Yeah.
Maybe I can take this question and then you extend, Andreas. So, we see this type of fixed full arch rehabilitation as something very important. So there is a own development stream. So we call it innovation clusters, where we work on those kind of products that are specifically needed. And I mean, to also be honest, we were not the first one to be the best one in this category. We had to learn quite a bit, and it takes a bit of time to also, raise to level of expectation of these complex cases. But we see potential in further developing, let's say, pterygoid implants. We see potential in further developing also Zygoma implants. And as we discussed before, there might be an opportunity for subperiosteal implants for specific, cases. As technology evolves, for example, also very accurate cone beam CTs combined with additive manufacturing or hybrid manufacturing opens up new possibilities for really providing to you as dentists that do those special cases the armatory to treat these patients and really help them to go through this life-changing experience for, from having no teeth to having fixed teeth again. So yes, definitely there is a lot that is ongoing with us. But yeah,
well, that's nice to hear because it's like I said, it's always preferable for a dentist like me or anyone out there to try and consolidate their, especially if they do a lot, is to consolidate their everything to partner with one trusted partner, and if you're able to then expand to the option of subperiosteal implant, and also at the same time maybe offer some training. Some of the questions were also to do with education and training that I noticed. Some of the questions in the on Instagram were in the poll that we're asking. Yeah. So if you can incorporate some training in that area as well. Where that would be important, I think.
Yeah, no, we are super strong believers in, pushing the boundaries and evolving technologies. And there, as George alluded, we have a lot of ideas, but always combined with really, let's say, world-class education and, where we need people like you and other great clinicians, because we cannot deliver this. That's where we need the ITI and a lot of other skilled clinicians to provide this education, because only then you can be successful as a clinician in especially in cases like you are doing them, and that are really world changing. So for me today, what stood out, I have to say, I met a very passionate person, a great clinician. I think you are very purpose driven. I like this, Alex. I think it's also where you start, grabbing the motivation of the people surrounding you that are the fundament for your success. And you have this passion for evolving and for changing lives of people, which is, I think, a great purpose to have. And I like your purpose of, or your passion for education and evolving the field and, helping the people around you to evolve and to become better clinicians over time. So thanks a lot for being with us. It was a very exciting 45 minutes with you, Alex. Thanks to make all
Thank
of
you so much.
Thanks a lot, Alex.
And can I just plug something very quickly?
Sure, yeah,
so
absolutely.
we've got McKenna's Summit happening. Is going to be between the 5th and the 10th of July in 2026. Like I said, the pre-registration is almost full. I think there's a few more spots. If anyone is interested, probably in the next 2 weeks it will be finished. So please put yourself on that pre-registration list. The ones on the pre-registration will be guaranteed a room within the conference hotel. Anyone who's not successful in the pre-registration will have to wait for the registration to open, and they might not be able to get a room in the hotel. They will need to get elsewhere. So 5th to 10th of July, you can't miss that one. And I think you already know it's limited to 250 people. It was full last time. It will be full again even quicker this time. So get yourself on it if you want to be in it, and hope to see you there. So thank you very much, guys, also for for this opportunity.
No, thanks. And I can only underline what you said and recommend for everyone that is interested in this field of complex full arch rehabilitation to sign in for Mykonos, because you will not regret being there and learn a lot from great clinicians. I know that. So thanks a lot, Alex, for being there. Thanks a lot for listening in to our listeners. Please continue to subscribe to our podcast so that you're not missing the next episodes as well. And if you want to engage with us, if you want to ask some questions, if you have some comments, we're always very happy to have them on our Straumann Global Instagram account. So thanks for listening in. Thanks, George, for co-hosting. Alex, thanks, and hope to see you soon.
Thank you.
It was a pleasure.